Hello and welcome to PCR London Valves 2025. I'm Chris Cook, an interventional cardiologist from the UK, and I'm delighted to be joined live in the studio by two of our course directors, Prendergast and Simon Redwood. It's been an electric atmosphere here with over 4,200 attendees this year, and it's our job today to discuss what the highlights were from the aortic track. So Simon, first question to you. Can you pick one of your highlights for us?
Well, it's very difficult because it's been such a big meeting and there's been so many sessions and focuses, but I think probably my number one is to talk about lifetime management. We've had several sessions where we've talked about this, and it's particularly important this year with the change of the guidelines, the European guidelines now moving down to recommend TAVI in patients over 70. And so we're talking about index valve choice a lot, and we're also talking about what to do in the future 10, 15 years down the line. So it's really been fascinating. You know, which valve should we choose? Which one will give the better access to the coronaries in the future, should that become necessary? Which valve will be the most durable? And it's been very nice to see the PARTNER 3 7-year results that were presented both at TCT and at this meeting, where broadly speaking, we've shown equivalence, at least equivalence, if not superiority of TAVI over surgery.
The field has come along so far. It's way beyond index procedure now, isn't it?
Absolutely.
Okay. So Bernard, how about from your side?
Well, we need to remember also that as well as aortic stenosis, we have aortic regurgitation, and there's been a lot of focus on that topic at this year's meeting. We've had a spotlight session in conjunction with our colleagues from TCT, Partners in Learning, a full main arena focusing on this topic in detail. We've had a dedicated session within one of the breakout rooms looking at the imaging around aortic regurgitation, the importance of multimodality assessments beyond echo, which we know can be challenging in aortic regurgitation, and the particular additive value of MRI and CT imaging to increase our understanding of the pathophysiology. And the jewel in the crown was the presentation in the main arena of the late-breaking trial Align AR, looking at the clinical outcomes with 700 patients in a very large series using the Jenner valve with outstanding clinical outcomes and simultaneous publication in the Lancet. So this is a really big news story for London Valves, one we're very proud of, and a signature of what's coming in terms of aortic valve intervention.
It's such a good point. Again, to the maturity, we're talking now beyond aortic stenosis. So thank you for sharing that with us. Simon, have you got one more highlight you can share with us?
Well, yes, I guess following on from talking about lifetime management, it's talking about redo TAVI and TAVI in surgical AVR. And there's been a big focus on that. We've seen several live case demonstrations of redo TAVI, showing that actually it's not as simple as we originally thought it was. There are a lot of procedural considerations. We've been through those in details. We've had detailed CT analysis. We have all these new terminology of the coronary risk plane and the neoskirt plane, and it's been absolutely fascinating.
Fantastic. Thank you both so much for sharing your insights with us. We really enjoyed hearing about it. And thank you as well for watching at home. Goodbye.